everyone. It is so exciting to be here. This is our 5th annual Miles for Migraine event. So I'm going to ask some questions because I'm curious as to who is here today. So I'm going to ask you to raise your hand, and if you raise your hand, keep your hand up in the air. So raise your hand if you care for patients with migraine as a doctor, as a nurse practitioner, PA, as a nurse, as a CMA. If you in any way help answer phone calls or do anything to care for patients with headache, raise your hand. If you are a child of someone who helps care for patients with headache, or a spouse or partner of someone who cares for patients with headache, raise your hand. If you are a patient with migraine, raise your hand. If you are a spouse or partner or child of a patient with migraine, raise your hand. If you are a runner today, raise your hand. If you have or know a friend, a family member, a colleague, or have heard of someone with migraine, raise your hand. So you can see we are all touched by migraine and other headache disorders. More than 40 million Americans have migraine. Cluster headache is as common as multiple sclerosis. So headache is something that touches all of our lives. You heard from Lauren, when people have migraine, it changes the brain in a way that people become sensitive to light and to noise. And so when someone has a migraine attack, going into a quiet, dark room helps improve the pain. Unfortunately, that also makes people feel like they're alone, they're isolated, they have to hide their disease from other people. That's why events like today, Miles for Migraine, are so valuable, because we're bringing it out into the open, into the sunshine, becoming overcomers, and changing the way people understand the disease of migraine. We do not have to hide behind the disease of migraine. I want to really thank all of our industry sponsors who are here today. If you haven't already, please go visit them. They've got samples, they've got foods, they've got lots of brochures. A lot of great, exciting new treatment options are available. We're also conducting clinical research at Wake Forest. We're about to start several awesome clinical trials of both pharmacological and non-pharmacological options. So get involved in research. And I just want to thank you for being here today. Because you are here, we are all working together to change the face of migraine. Thank you so much.